I'm Dr. Josh Hamilton. I'm a 2003 graduate of the Master of Science in Nursing, actually the Family Nurse Practitioner option at UW. Currently I'm the Dean of Health Science at the College of Southern Nevada in Las Vegas. I thought there was a doctor living in here someplace, a physician, and so I was square set on medical school for a long period of time. And when I didn't get in the first time through, I reapplied and knew that I probably would the next cycle, but I thought maybe I would be a better physician if I became a nurse first. So I went to my community college and took an associate degree nursing program, and I have never looked back. My career has been very memorable. I think that one of the things that generates those stories is the line of work I've chosen to go into. I've been a psych nurse for the majority of my career. I remember early on I worked at a 75-bed inpatient psychiatric facility, and I had a patient who was psychotic. He had his first psychotic break very young and was in a locked seclusion. And we were trying to do everything we should do. I was trying to empower him and to engage him, and we had served him his lunch, and he had thrown it all over the timeout room, the seclusion room, and had made a big mess. And I remember thinking, well, I need to empower him and give him some responsibility. So I went and wrung out a mop and attempted to explain to him that he needed to clean up the mess he had made. And I handed him the mop, and I knew the minute it left my fingertips that this was going to be a problem. Immediately, he turned into Bruce Lee on me. So here we were at the other end of a man who wasn't thinking clearly, who had a weapon in his hands. And I remember closing the door just in time before he came at us and thinking, there's a fine line between empowerment and caretaking. And this was a great example of when someone couldn't be empowered. One of my first memories of my time at the University of Wyoming actually came before I was a nursing student. I very early on was a natural science and mathematics student, and again I was a pre-medicine major, and I lived in Casper, so I was very interested in what the outreach school had to offer through the UWCC Center. I needed an elective, I needed an upper division elective, so I actually enrolled in a family nursing course because I could. And I remember walking into that class at the Outreach Center on North Poplar in Casper, and sitting at the head of the table was Sue Steiner. And two other students I didn't know, and that was us. There were two nurses who were in graduate tracks, and me. I never had anything to do with nursing other than the nice lady who gave me my allergy shot. And it was Sue Steiner who tried to incorporate me into what they were doing, tried to catch me up. Again, these two, my fellow students, were already at the graduate level. And I remember walking in saying, you know, I need to drop your class. I tried for a week, and it just wasn't going to work, that we were an odd number, there was a lot of group work, and Sue was very kind. And I was very interested in what it must be like for those students who were advanced practice nurses and who had taken that career to the next step. And that always lived in the back of my mind. I completed my bachelor's degree in science and math, but I always remembered that, and imagine my relief when I finally made it to Laramie for my health assessment course to become an FNP, and sitting at the head of the table was Sue Steiner. Very comforting for me. I have loved being a practitioner of nursing, whether that's been at the bedside, whether that's been in systems, inpatient, outpatient, in administration. Everywhere I've been, everywhere I've taught, I've tried to keep a foot in the clinical arena. And as I've become more aware of and become more appreciative of evidence and how that fits in practice and where research could fit, I was never fond of research for research's sake. I've always had a great deal of respect and admiration for those nursing scientists who produce new research, but for me it was always, where does the rubber meet the road? How can I take that research and translate it into this system, this particular setting? How can I make that work for me? So really being a scholar and being very involved and immersed in the academy has always been important, but always keeping that grounded sort of sense of what's happening out in the world, what's going on in practice. How does what we're teaching students today translate to better healthcare out there? So I think the legacy that I leave is being a consistent role model of that particular mindset and how effective it can be.